Your doctor looks at your results, nods, and says everything looks fine. And they mean it. They are not wrong based on what they tested. But here is what most people sitting in that exam room never find out. The standard blood panel ordered at a routine physical in America regularly misses the markers that matter most for adults over 60. The ones that quietly predict what is coming years before it arrives. And that gap between what gets tested and what should get tested is where too many serious health events in seniors begin. I am Dr. Linda Thompson, and on this channel I bring you clear, evidence-based health guidance designed specifically for adults over 60. Today I am giving you the names of 5 blood tests that research consistently links to heart disease, memory decline, falls, and metabolic damage in older adults. I will tell you the exact numbers you need to see on your results, and I will give you the precise words to use with your doctor if these tests are not already part of your routine panel. Many of the people I have worked with spent years being told their labs were fine. They felt tired, foggy, and not quite themselves. They assumed it was age. For some of them, it was not. It was information that was never collected. Stay with me through all 5, because the last one on this list is the one that surprises people most, and it may be the most actionable of all. Let us start with the first test. You have probably had a fasting glucose test at some point. Your doctor orders it. You fast overnight. They draw your blood first thing in the morning and measure your blood sugar at that single moment in time. If the number looks acceptable, you are told your blood sugar is fine. But here is what most people never realize. Blood sugar fluctuates throughout the entire day. A single morning measurement can look perfectly normal even when something damaging has been building quietly for years. The first test I want you to ask for is called hemoglobin A1C. Unlike a fasting glucose test, the A1C does not capture one moment. It measures the average level of sugar in your blood across the previous 3 months by examining how much glucose has attached itself to your red blood cells. Think of the difference this way. A fasting glucose test is a single photograph. The A1C is a 3-month journal. One tells you what things looked like on one particular morning. The other tells you what has actually been happening inside your body day after day. Here is why this matters so much for adults over 60. Pre-diabetes, which means an A1C between 5.7 and 6.4%, silently damages the small blood vessels feeding your kidneys and the delicate capillaries behind your eyes. Research suggests that pre-diabetes accelerates cognitive decline in older adults at nearly twice the rate of normal aging. And studies indicate that 96 million Americans currently have prediabetes. 80% of them have no idea, not because they have not seen a doctor, because the right test was never ordered. You want your A1C below 5.7%. If it falls between 5.7 and 6.4, that number deserves a serious and immediate conversation with your physician. If your doctor only orders a standard glucose test at your next visit, ask by name for the hemoglobin A1C. They are 2 separate tests, and one of them is significantly more informative for understanding what your blood sugar has actually been doing. Do you know your current A1C number? Drop it in the comments below. I read every response, and knowing what people are actually seeing on their results helps me understand what to cover next on this channel. Now, here is what most people never realize about the second test on this list. The second test is called 25-hydroxy-vitamin D, and this one is misunderstood by almost everyone who has heard of it. Most people think of vitamin D as a simple supplement, something you take for bones. But inside your body, vitamin D behaves more like a hormone than a vitamin. It actively regulates hundreds of different cellular processes, including immune function, muscle strength, mood regulation, and brain health. And research suggests that more than 40% of American adults are deficient. That rate climbs considerably after age 65, for a reason that makes complete sense once you hear it. As you age, your skin loses much of its ability to convert sunlight into vitamin D efficiently, and most older adults spend the majority of their time indoors. Those 2 things together create a deficiency that builds slowly, silently, and almost never shows up on a standard panel without a specific request. Studies indicate that vitamin D deficiency in adults over 60 is associated with a meaningfully higher risk of bone fractures, cardiovascular events, and accelerated cognitive decline. These are not minor associations. These are findings that should change how urgently we approach this test. Here is the part that matters most. Most labs consider anything above 20 nanograms per milliliter to be within the normal range. But research and many specialists in older adult health suggest that optimal levels for adults over 60 fall between 40 and 60 nanograms per milliliter. There is a real gap between what the lab calls normal and what the evidence calls optimal. And that gap has consequences for how you feel and function every single day. Many people I have worked with were told their vitamin D was fine based on a result that by research standards was meaningfully low. When we brought their levels into a genuinely optimal range under careful medical supervision, the changes they described in energy, mental clarity, and joint comfort were often significant. If your next blood draw does not include a 25-hydroxy vitamin D test, ask for it by that name. And when your result comes back, ask your doctor where your number falls relative to the 40 to 60 range, not just whether it clears the lab's minimum threshold. But the third test is the one that stopped me cold the first time I worked through the research behind it. The third test is called high-sensitivity CRP. CRP stands for C-reactive protein, and it is a direct measure of systemic inflammation inside your body. If there is one word that ties together heart disease, memory decline, and certain cancers in older adults, that word is inflammation. Chronic, low-grade inflammation burns silently through your tissues for years, sometimes decades, before producing a diagnosis that anyone recognizes. The high-sensitivity CRP test can detect that fire while it is still small enough to do something meaningful about. Research from a landmark study following tens of thousands of adults found that high-sensitivity CRP was a stronger independent predictor of future heart attacks than LDL cholesterol. That is the number most physicians spend years carefully tracking. And yet, high-sensitivity CRP is rarely included in a routine panel without a specific request. Here is what the research adds beyond heart health. Studies indicate that adults over 65 with chronically elevated CRP are significantly more likely to develop mild cognitive impairment over the following several years. The inflammation quietly damaging your arteries is the same inflammation quietly degrading your brain tissue. These are not separate problems. They share the same underlying mechanism. You want your high-sensitivity CRP below 1.0 milligrams per liter. Between 1 and 3 represents moderate cardiovascular risk. Above 3 warrants urgent investigation and a serious conversation with your physician. When you ask for this test, be specific. Ask for the high-sensitivity version. A standard CRP test and a high-sensitivity CRP test are not the same. The high-sensitivity version can detect subtle elevations that the standard test would miss entirely. Now here is something most people in their 60s and 70s are never told about the fourth test. The fourth test is TSH, which stands for thyroid stimulating hormone, and this one affects far more older adults than most people realize. Your thyroid is a small gland in your neck that functions like the control panel for your entire metabolism. It regulates your energy production, your body temperature, your heart rhythm, your mood, your digestion, and your ability to think clearly. When it begins to slow down, every one of those systems slows with it. Studies indicate that 1 in 5 adults over 60 has some degree of thyroid dysfunction that is either undiagnosed or inadequately treated. The symptoms of an underactive thyroid include fatigue, unexplained weight gain, cold sensitivity, constipation, low mood, and persistent mental fog. And here is why it so often goes undetected. Those symptoms are almost identical to what most doctors and most patients simply attribute to normal aging. So the connection is never made, the test is never ordered, and the person continues feeling consistently unwell without understanding why. Here is the part that matters most. Standard laboratory reference ranges for TSH go up to 4.5, but a growing body of research and many specialists in geriatric medicine argue that optimal thyroid function in older adults corresponds to TSH levels between 0.4 and 2.5. A result of 3.8 will be flagged as normal by most labs, and technically by that reference range it is. But there is a meaningful difference between being within a reference range and being optimally well. Have you ever been told your thyroid looks fine but you still feel consistently tired or mentally slow? Drop a comment below. I want to understand how many people watching this are living with exactly that situation right now. And now the fifth test, The one I consider the most underused and most important test on this entire list for adults over 60. The fifth test is called homocysteine. It is an amino acid that accumulates in your blood when your body is not getting enough of certain B vitamins, specifically B6, B12, and folate. And when homocysteine builds up, research suggests it becomes directly toxic to blood vessel walls and brain tissue. The original Framingham Heart Study, one of the longest-running cardiovascular studies in medical history, found that adults with homocysteine levels above 14 micromoles per liter had nearly double the risk of developing Alzheimer's disease. Nearly double. And a formal consensus statement from Alzheimer's researchers across multiple international institutions concluded that elevated homocysteine is a modifiable risk factor for cognitive decline in older adults. The word modifiable is the one I want you to hold on to. This is not a risk factor you simply have to accept. It is one that can be meaningfully addressed. Research from Oxford University found that B vitamin supplementation specifically targeting homocysteine reduction slowed the rate of brain tissue loss in people with mild cognitive impairment by 30% over 2 years compared to those who received no treatment. In participants who started with the highest homocysteine levels, that reduction reached 53%. These are not small findings. These are results that should make homocysteine testing a routine part of every senior's annual blood work. And yet most standard panels never include it. You want your homocysteine below 10 micromoles per liter. Between 10 and 15 is moderately elevated. Above 15 requires immediate attention and a conversation with your physician about next steps. Many people I have worked with came to me with memory concerns, word-finding difficulties, or a sense that their thinking had become slower and less reliable over the previous year or two. Their standard labs were unremarkable. When we tested homocysteine specifically, elevated levels were a consistent finding. Addressing those levels under careful medical supervision through targeted B vitamin protocols was one of the most consistently meaningful interventions I have seen in older adults. Research suggests the right forms of these vitamins matter. Methylfolate and methylcobalamin are the forms most effectively absorbed by older adults, and they are meaningfully different from standard folic acid and cyanocobalamin. As always, any supplementation should be discussed with your physician before you begin, particularly if you take blood thinners, kidney medications, or any existing thyroid therapy. So here is your action plan. Specific and clear. Before your next appointment, write down these 5 test names on a piece of paper and bring it with you. Hemoglobin A1C, 25-hydroxyvitamin D, high-sensitivity CRP, TSH, and homocysteine. Tell your doctor you would like all 5 added to your next blood draw. If insurance coverage is a concern, ask your doctor's office about ordering these tests through a direct lab. Many of these tests cost between $15 and $40 when ordered independently. That is a small investment compared to what goes undetected without them. When your results come back, do not just ask whether each number is normal, ask where each number falls relative to the optimal ranges we discussed today. Normal and optimal are not always the same thing. And for adults over 60, that distinction genuinely matters. You deserve blood work that reflects the full picture of your health, not just the minimum standard required to clear a reference range. Drop a comment below and tell me which of these 5 tests you have already had done. Just the names, or the numbers if you know them. Knowing what seniors across the country are actually receiving from their routine panels helps me understand where the biggest gaps are and what to cover next. If this gave you something useful, please share it with someone you care about who is over 60. One conversation with the right information genuinely changes what happens at the next doctor's appointment. Subscribe if you have not already, because next week I am covering the specific category of commonly prescribed medications that research now links to accelerated memory loss in adults over 60. It is one of the most important topics I have covered on this channel, and it is a video you will not want to miss. Take good care of yourselves. I will see you next week.